Hi there, I'm Claire McDonnell Liu, and this is the Family Health Lab. In today's conversation, I'm talking ketogenic diets for mental health with Jan Ellison Baszucki of the Baszucki Group. Jan is talking about her son's experiences with bipolar, the massive impact a ketogenic diet had for his health and well-being, and the work that she's doing with her foundation to research ketogenic diets for mental health internationally.
You're listening to the Family Health Lab. Healthy parents, healthy kids.
Thank you so much for coming on to talk about keto for mental health with me.
Hi, Claire. Great to be here.
I believe I read that you had been on a keto diet alongside your son or at some point. So I'm just wondering about that journey for you. How was that?
For me personally, aside from how it's been for my son, it's been great. I've been, yo-yo dieting for 40 years. So, and I've been on low-carb diets. I've been on paleo diets. I've been on autoimmune paleo diet, vegetarian diet, you name it. We've been on it. We went on ketogenic diet to support him in his mental health journey. And, it was nice for me. I lost 20 pounds and it's been very easy to keep it off for the first time in my life. So I'm not complaining. It also kind of resolved my brain fog and I have a lot more energy. So it's been for both my husband and me and for our son, really just all positive.
Excellent. Those types of things, like you're saying, the energy levels, the brain fog, they're just such good bonuses. A lot of people go on ketogenic diets, as we know, over the last 8 years. It's really mushroomed in popularity as a weight loss tool, or the freedom from cravings that I found personally was really interesting and just much more mental clarity.
Yeah.
So you enjoyed it then, pretty much.
Yes, so we're committed now. I read Nina Teicholz's book, The Big Fat Surprise, when it first came out. That's maybe, 8 or 9 years ago. And that's when I got us off of the low fat. I was raised in LA in the 80s. It was all low fat. And finally, after all these years, I realized I was feeding my kids the wrong foods. And so I've been on that now for 8 or 9 years, but we hadn't really gone keto per se. Not strictly anyway, until 2 years ago when our son went on for bipolar disorder and his symptoms resolved after about 4 months.
Amazing. I think knowing a little bit about your journey with Matt's health, it is amazing that was resolved in 4 months after, was it 5.5 years or around that? A long time he was struggling with his mental health, his son. He meant to manage his mind, and it wasn't for want of trying. By the sounds of it, he had tried so many different options, and you had too. Would you mind telling us a little bit about Matt's journey?
Sure. So we have 4 kids. Our son is the eldest, Matthew. Calling him Matt. He was like the star, in high school. He was taking multivariable calculus as a sophomore with a room full of seniors. He was playing in the jazz band, upright bass. He started chess club. He was captain of the varsity water polo team as a junior. And then he started junior year in high school when he was 17. He started to have insomnia and panic attacks and what you might call like a nervous breakdown. Just a lot of stress, too much academic stress and whatnot. And then he got better, but 2 years later, when he was a freshman at UC Berkeley, he had a full-blown manic episode. He didn't sleep for 2 weeks. He didn't sleep at all for 2 weeks. People don't fully understand that in bipolar disorder, bipolar 1, with severe manic episodes, people stop sleeping completely. And that, of course, doesn't help with mental health. So that was in March of 2016, and we brought him home. He was hospitalized at Stanford for 10 days. He was heavily medicated, but just with a single medication at that point. And then it kind of went from there, and it was for 2 years he was in and out of the hospital. We just couldn't get him stable. It was always mania. He didn't have so much the depressive side. And then he got insight. He had been away from home for a couple of weeks, and we couldn't find him. He'd been roaming around LA, took a bus to LA, And we finally reestablished contact and then got him hospitalized again for the 4th time. And after that, he decided, he kind of understood that he was ill. He hadn't fully understood that or accepted that the first 2 years. And then he spent 3 years putting in place really every measure he could. He was med compliant. He was seeing a psychiatrist. He was doing DBT, CBT therapy. He did something called neurostimulation at Stanford, transcranial magnetic stimulation, where he had a magnet on his head off and on every hour for a week. He tried orthomolecular medicine, so very customized supplement protocol. What else did we try? I mean, you name it, we tried it. Functional medicine, other kinds of diets. And he was getting better. He was more stable. He was living alone. He was going back to school, but he wasn't well. And every day he had symptoms of some kind, anxiety or irritability or hypomania or mild depression or cognitive impairment, executive functioning trouble. And he hadn't had any of those troubles until he was 17. I mean, he was like fine. He was completely healthy and thriving. And we kept hearing from the psychiatric community, well, he's euthymic, or, he's always going to have cognitive impairment, or executive function, it'll never come back. And we just weren't willing to accept that. And then I happened to meet somebody who had a podcast, actually. He has a mental health podcast, who talked about his journey of going on keto for bipolar disorder, and I got really interested, and I learned about the work of Chris Palmer, who's a physician at Harvard who has been treating his patients, seriously mentally ill patients, with ketogenic diet for 10 years, and started to read everything I could, and he was game by that point. Matt was like, yeah, I want to try it. When can I start? Diet was the last frontier for him at that point. He tried a lot of different diets, but it never really stuck to it. And at that point he was ready, and he was stable enough to try it. So, it's hard to get somebody on a diet when they're psychotic or they're manic or they're so depressed that, they can't get out of bed. He was well enough that he was ready to take it on. And I had help with the meals. We worked with Chris Palmer, actually. He helped us figure out what the diet was going to be, introduced us to Denise Potter, who is involved with the Charlie Foundation for Epilepsy, and she's been working in pediatric epilepsy for her entire career. And so we pretty much used the protocol from epilepsy. It was more like a modified Atkins kind of diet, where it was 60% fat-ish, 60% roughly, and just a whole foods ketogenic diet, very low in carbohydrates. I think we were shooting for 20 carbohydrates per day in the first 6 months or so. And he started it 2 years ago in January, so 25 months now, I guess. And when we knew something was changing when in March is usually mania season for people with bipolar 1. The light is changing more rapidly than at any other time of the year, and that is very difficult for people with bipolar disorder. And so he had typically had to go way up on his medication, like 5 times as much in March, just to stay well. And then it'd be this whole thing about trying to get him tapered back down because of the terrible side effects, metabolic side effects, cognitive side effects. That year, he didn't go up at all. He stayed on the same dose, and he had no symptoms of hypomania. And then within 4 months, by April, May, he had no symptoms at all, including anxiety, brain fog. It was all resolved. It's like he doesn't have a mental illness at all now. I should say he's very committed to his lifestyle measures. Doesn't drink, he doesn't smoke, he doesn't stay out late. He eats a whole foods ketogenic diet. He meditates, he exercises daily. So he's very focused. But until he went on the diet, he had all that in place, and he still wasn't well. So we know that was the final piece. That is what made him completely himself, better than ever.
That's something that I've heard you talk about, that you had tried so much, and he'd got to a place where his symptoms were much better, but he was still having symptoms. So, I mean, I'm just so impressed with Matt being so young, going through all of this from age 17, having no history of this, and bipolar, I don't think really many people understand how severe and how debilitating that is, and the trauma that you must have gone through as a family, you know, when you were looking for him, when you were visiting him in institutions, when you were trying to kind of go for the next therapy, contact the next person, read the next ray of hope. But what an impressive young man for him to try to control and optimize his sleep and his nutrition beforehand, and all of those different aspects of his health, and then be game on for trying the ketogenic diet when that was raised for him in, I think it was 2021. He went on it after 4 or 5 years of struggle. So yeah, I think you have to be ready. I echo your comments. My daughter went on the ketogenic diet. She was on a 10 grams of carb per day limit, and it would have been 20 for an adult, 10 for her age, her size. But yeah, that was within our control. We just adapted and changed the foods. So, you know, it can be harder to adapt, and you've got to be. It's not something you can dabble with when it's medical. You know, you've got to go all in and adhere to it. So he didn't cheat. He went fully in.
He has never cheated. He has never. I should say he has never. You know, he's never had a piece of bread. He has never had a French fry. He's never had a roll or a bite of rice. He was very, very strict in the first, I would say, year, maybe 9 months to a year, about measuring his ketones, tracking his total carbohydrates, we had a program where each meal was in a ratio of carbohydrates to protein plus fat, or fat to carbohydrates. And so it was very regimented. Then there was a point at which he wanted to get very big in the gym, so he's lifting weights. And he started eating a lot to just try to get more calories. And I think that may have kicked him out of ketosis for a while there. He has remained stable, though, the whole time. Mm-hmm. Recently, he had a shoulder injury lifting weights, actually. And he kind of had to lay off of that, and he lost some weight, and he feels metabolically more healthy. So now he's back down to only eating 2 meals a day and doing intermittent fasting from probably 7 p.m. to noon. And he has now told me that he's going to stick with that protocol. Has said it's not worth making gains in the gym if his metabolic health is not, you know, at top form. So now he's pretty committed to measuring ketones again, and he's in ketosis. He's in ketosis every day. And he's just doing great. He has a full-time job. He's got tons of friends. He's writing a fiction. He wants to write a fantasy novel. He's got a lot of projects, but not in that hypomanic or manic way, just in a very calm, steady, deliberate, the person he was before he got sick.
Mm-hmm. So his executive function, his ability to focus and manage himself, that's all come back. And at some point you must have been very, very concerned if whether you would get full Matt back.
Oh, it was. When he went off to college, I remember he packed himself up, he registered everything. I mean, he moved himself in. He was never one of those boys who has trouble with executive function. He was always super competent, super independent. And then after he got sick, I mean, my husband and I pretty much had to take over everything. And it was so hard for him to not be independent in that way. There were, filling out forms was hard for him. Between the illness and the medications, his brain just was not working for such a long time. And he had to keep changing majors. He had to drop classes. He'd drop out and have to leave in the middle of a semester. And he'd been such a star academically that it was very difficult for him. For 5 solid years, it was very hard.
Yeah, and I'm sure it leaves its mark when you've been through that type of trauma, and with your mental health. And so all credit to him and you as a family for pushing. I know you've mentioned lots of the different treatments that you tried and therapies. Before you got to keto, there were numerous. Well, Was it 41 medications he'd also tried, and over a day,
29 medications. But he was seen by more than 40 healthcare professionals, including his inpatient stays in hospitals, total 5 hospitalizations, many residential treatment centers, partial hospitalization programs. I mean, you name it, he was in it. Young adult transition programs. We tried a lot of different things, and most of it didn't work. I mean, I would say, I think probably the anti-psychotic medication that he initially had saved his life. He hadn't slept in 2 weeks. I wasn't going to be able to put him on a ketogenic diet. He had lost touch with reality completely, and he was delusional. So the medications in the hospital got him sleeping, brought him down enough to be, to be able to come home. But they never restored his personality or his cognitive function. His brain didn't start working fully again until keto. Mm-hmm. And now he is thriving, absolutely thriving.
And I think that's the important point. The medications are there, and they absolutely have their place. As someone whose family members been in a similar situation in and out of institutions to get some support for breakdowns, the medication is very reassuring and very, very helpful at times. It's just not a long-term strategy to return you to your full mental capacity, which is what we want for our family members and you for your son. When we were looking for our daughter for her epilepsy seizures, at that point she wasn't diagnosed with epilepsy, it was febrile seizures. We were doing our own research as a family and looking at different therapies, trying different things. We optimized sleep and optimized her exercise and her diet, and we went on supplement protocols, all of that type of stuff. And we were looking into CBD, and they did have an impact. We kind of called it the 1%, where each one of those was beneficial, and then there's a kind of knock-on effect where that is helpful. Then the immunity is better, your sleep is better, so therefore you're getting less, you're under less stress, less. So for us, that was helping with the neuroplasticity of reducing seizure episodes and reducing those triggers. But it wasn't returning her to a state, a functional state. It wasn't eliminating the seizures. So we found out about 2 different therapies for us that were game changers. The first was a seizure rescue breath, which is pretty unknown still, I'd say, where we could breathe into her nose, and it amazingly changed the biochemistry of her brain and stopped a seizure without medication.
Wow.
We were mind blown, and it's something to do with your pH levels in your brain. So we were applying that, and that was so helpful because she was on so many benzodiazepams for stopping prolonged seizures. And then we found out about Keto Diet, and from parents' blogs, from families like yourself who'd been through situations, sharing their knowledge. And it was a family in Canada who were blogging and sharing. I was like, what is this diet that she's drinking these vials of olive oil and it's stopping her seizures? So then the research at night goes on. I'm looking all over the place, and I'm contacting families in America and in Canada and looking for these American centers, and then the Charlie Foundation. And then I found out my own hospital that we were going to see had a keto clinic. I was like, what? I'm crazy.
I didn't say that. That was just wrong. That is so wrong. And we found out our son was treated at Stanford. We had a former head of the bipolar clinic at Stanford was his psychiatrist. I was meeting with Stanford all the time because we were investing in startups. We were funding research. Turns out there was a metabolic psychiatry clinic at Stanford. Started in 2015 using ketogenic diet for bipolar and schizophrenia. I never heard of it. I heard about it because I watched a podcast that was made in Scotland. And the very last thing was, and here's this trial at Stanford. And I was like, are you kidding me? Nobody ever said a word. Nobody.
My goodness. That's crackers. I was saying at the beginning of our conversation before we jumped on to this podcast that I was talking to Emma Williams of the Matthews Matthews Friends charity, and she was saying that we were talking about what anger does for the world, because two angry families, Charlie's Foundation and Matthew's Friends, have changed ketogenic diet history by not wanting other people to go through and endure the pain and the suffering and the damage that they have suffered as families, and yourself Matt was potentially could have been on those trials or within that. I think for ours, we understood that when we approached them about keto for our daughter, they were she's not going to be considered, because you've got to fail. It's got to be intractable epilepsy, so you've got to fail medication first, at least one, no, at least two, and then often multiples, which takes years. And by that point, our infant would potentially be damaged with prolonged seizures that weren't stopping. So it wasn't
not to mention the medication, the effects of the medications.
The side effects, yes, and I mean side effects that which we kind of brush over, which were really kind of pushed down within our clinics and our neurology meetings with our pediatric teams, where the side effects of keto were really, really pushed at us. You know, this is unsustainable, it's unpalatable, it could be damaging, you could have weaker bones and not meet your growth potential. It's like pretty clear to me from reading information out of Hopkins and Great Ormond Street that you can manage those and mitigate those, where side effects from medication were really not openly discussed. But yes, we as a family went our own route and put our daughter on, and we kind of got private support to back us up on that, and then went back to the clinic, and kindly the dietitian eventually saw us in the reception out of her clinics and gave us some kind of pro bono support. But we were already, I think, 9 months, a year in when we started to kind of get taken in under their wing. And we'd had results within days, I would say. As soon as the ketones kicked in, the seizures started to stop. I mean, they were daily hundreds. Angry families and traumatized families, really.
Angry. I'm definitely, I'm not angry now because he's well and we have a path to helping. But yes, I was very angry for many years. And then, just the notion that a diet could resolve serious mental illness. I mean, we have case studies of schizophrenia of 40 years of hallucinations and voices that within a few months are gone on a ketogenic diet.
My goodness.
It's astonishing. And yet, after a single successful trial in 1965 of ketogenic diet for schizophrenia, no, not a single controlled trial was undertaken until the Stanford trial in 2020, I think, was it started in 2020, is now complete. And I keep saying, why, if it could work for seizures, and we knew it could work for seizures, did nobody think to say, let's try it for some other brain-based disorders? And with psychiatric disorders, I mean, there is this stigma around, we know that it's kind of related to the brain, but it's separate from neurology. Neurology and psychiatry, two separate worlds, they don't interact. So even if ketogenic diet is working for neurological disorders like epilepsy, no, it's not going to work in psychiatry because that's different. That's somehow psychological rather than neurological. But of course it's not. It's all the brain.
Yes, and as Georgia Ede has said, and I mentioned that recently, that the science is there. We just now need to demonstrate this with more trials, which brings us neatly onto your epic work. I'm so excited. When I first heard about what was coming out of the Baszucki Group and the trials, I was just so delighted. And first I read for bipolar, which is massively important. I don't think people realise how devastating that condition can be and how prolific it is. Mental health generally, it's 1 in 5 affected, and 1 in 5 children predicted to be affected by mental health. And then we've got high stats of bipolar. But I'm also very excited that this is your work and the trials and the groups aims at also spreading to other areas of mental health. Do you want to? I'm really excited to hear more about that.
Sure. I mean, the way it started, honestly, was just me calling people like you said, calling families, calling physicians, calling researchers. I would just call them up and say, can you tell me about your work? And we started to meet people like Georgia Ede. Chris Palmer had helped us with the diet. We found out that a group in Scotland had been trying to get a ketogenic diet trial funded for bipolar disorder for years because their son, who's now a co-principal investigator on the trial in Scotland, had relief from bipolar 2 on a ketogenic diet. He's been well for 6 years, maybe it's 7 years by now. And they couldn't get funding because they didn't have any preliminary data. And I just said, how are you supposed to get preliminary data if you don't have funding for a preliminary trial? And so we gave them funding for a preliminary trial. And well, I should say the whole reason that our family foundation exists because my husband is the founder and CEO of Roblox. And Roblox happened to become publicly traded company the very month that Matt started to get better in March of 2021. And so we had resources then. We had some resources before, but then we had more resources to know that we could really help. And so we funded that trial in Scotland. We funded the Stanford trial so she could do the second tranche of patients, the second cohort of 10 patients. And then we reached out to other people around the world who were wanting to do this work. We found out about a trial that had already been funded at UCSF, but only for 1 month for schizophrenia. And I thought 1 month isn't long enough. And so we provided funding so that could go out to 4 months. That trial is underway. We reached out to Jeff Bolick at the Ohio State University. He's, one of the premier, really, researchers around ketogenic diet generally, not for mental illness. But he was very excited to do a trial for college students. And so that trial for depression is also underway. They are enrolling patients in conjunction with the college the counseling center at Ohio State. I mean, they have thousands of kids every year being treated for depression, and they know how to keep people on ketogenic diets at Jeff Bolick's lab. So we're very excited about that trial. And then the last one was in Australia. Zoltan Sarnyai had been a basic researcher looking at mice. He got interested in ketogenic diet after hearing about it in cancer, and he did the preclinical work. He basically cured schizophrenia. He cured mice of schizophrenia using a ketogenic diet. Again, he couldn't get any funding to study it in humans, but he had been wanting to for years. So we have given them a small grant for a pilot trial as well. So we now have 5 pilot trials underway. We have several major academic institutions proposing larger trials, but we want to learn from these first 5 trials that are covering schizophrenia, bipolar disorder, and major depression. And then we want to figure out what needs to come next, a larger, probably multi-site trial, but also education, public education and resources so that we don't just do the science, but that the science actually gets into the clinic, that it actually transforms clinical care. So we're working on that side as well. We launched an initiative called Metabolic Mind to provide resources. Bret Scher, who used to run the Diet Doctor podcast, has come on board with us to launch that YouTube channel and podcast and website. The really exciting thing for me is to see case studies and small trials popping up in all kinds of other diagnoses, like, for example, anorexia, ADHD, PTSD, alcoholism. We just learned that there's a depression trial in Canada that's already underway for adults. There's a trial in the DoD, Department of Defense, on depression and alcoholism, ketogenic diet. So all of a sudden we're finding out there's lots happening that we have been helping with, and there's lots happening that we didn't know about. So as soon as we hear about anything like this, we invite the investigators into this community that is starting to pop up, the metabolic psychiatry community. We have a Google group with, probably 100 members now. clinicians, researchers, dietitians, entrepreneurs, anyone who might be interested in metabolic approaches to mental health. So it's very exciting. I feel like we're just getting started, though. We have a long way to go, but already more and more and more people are reporting that they're having improvements. Some are, like Matt, completely in remission from what were supposed to be chronic lifelong illnesses, and some are still struggling but getting better.
It's so interesting how wide the potential is, and it makes sense, really. There's lots of comorbidities within mental health space: depression and anxiety, bipolar and depression. So it does, and alcoholism, addictions being part of the whole space as well. So that's really, really exciting. I didn't know the level, so I'm just so glad to kind of get on this call and chat with you about all of this. For me, another exciting part of this, because as I've said before, mental health just touches so many families. But then with keto, there's the metabolic potential. You mentioned Jeff Volek and his work demonstrating how sustainable these unpalatable unsustainable diets are.
Yeah.
So yeah, I mean, we just have so much great work from John Hopkins, with demonstrating for seizure control, but also with other neurological conditions. But metabolic health is such an enormous hidden part of mental health disorders and conditions. The fact that people are dying decades younger than they should, and they are suffering poor quality of life, and it isn't addressed and it isn't prioritized in a treatment plan, when, as you've said, we've had the potential to investigate and look at alternatives that would have a benefit for their metabolic health, that reduce the potential for obesity, reduce the potential for increasing their stroke and cardiovascular disease risk. So that's the another benefit, that this potentially works in Matt. It worked within months. The other case you've said, that's incredible, that case of the schizophrenia being addressed.
Two cases in schizophrenia, and then we have this study in France. It wasn't really a study. This is a French psychiatrist, Dr. Albert Danon, who had a family member who had autism and went on a ketogenic diet, and the family member also had seizures. I don't remember whether it was a boy or a girl. And the seizures disorder resolved, and the autism symptoms got much better. And so he, as a psychiatrist, with very seriously ill inpatients, he said, I'm going to try this. And the results there were 31 patients treated, 28 were able to stay on a ketogenic diet, to get into ketosis, to maintain it for a significant period of time. The periods of time vary from, I think, a few months to 18 months. They went home on Sundays, but they were fed in the hospital for 6 days. They managed to stay in ketosis even when they went home. And these were patients with very severe refractory illness, for sure treatment resistant, failed many medications, in and out of the hospital for years, sometimes decades. Schizophrenia, bipolar disorder, and major depression. And 44% of his patients, after being in ketosis, no longer met criteria for mental illness. They were completely in remission. I mean, and they left something like more than 60% left the hospital on less medication than when they went in, and lost weight. This has never happened in the history of mental health treatment ever. It's like lightning struck 28 times in one French hospital. We have to pay attention to this. This is a miracle. Why wouldn't we try it? People say, we don't have the evidence. And I say, do we have an evidence base for the standard American diet for serious mental illness? We don't. Mm-hmm. And we don't have an evidence base that suggests that these treatments aren't causing metabolic illness, as you have said. They are. We know that. Anti-psychotics, lithium, weight gain, diabetes, heart disease, stroke, you name it. We know that these drugs are causing those conditions. Mm-hmm. So if we have an intervention that is totally doable, practical, affordable, it exists now, it's safe. Why wouldn't we try it?
Mm-hmm. Absolutely. There's so many potential benefits, and not everyone is going to adhere long term. And going back to Matt's mindset, you have to be in the right place, or get the right support around you. But options for people and research, and why the pushback, I don't know. But in terms of your organisation and what you're doing, which is amazing, how people can get involved, it's mainly at this stage it's professionals, clinicians, to share work, share resources, get involved, perhaps make contact, show interest, and maybe join that particular group. And then in terms of the general public at this stage, what can they do? Is it a case of sharing the results, putting it in front of the clinicians' noses, printing it out and bringing it into the clinics and sharing it widely? Is that the kind of way they can support?
Yeah, I mean, I think two things. So one is that there are not a lot of clinicians trained to work with people with serious mental illness, but it's a growing number. So Georgia Ede has a directory, and if you go to metabolicmind.org, which is our website, you can access her directory to try to find a clinician. You'd be lucky if you find someone in your area, but many of them will work remotely. And then we have, but again, from Georgia Ede, we have a letter you could print out, take to your psychiatrist, say, I want to try this. We have lots of videos for families to educate themselves so that they can then educate their physician. And we have also linked to our site is the clinician training program from Georgia Ede. So we're hoping that clinicians will come to the site, get trained. Families will come and find clinicians. Families will find information they can take to their clinicians. Clinicians hopefully will then get curious, come to the site, find the training programs. We hope to provide, additional training or work with Georgia so that she can train more people, costs can come down, CME can be more widespread, and sign up for our YouTube channel and our mailing list. We're not sending anyone anything yet because we just got started. But as we get rolling, we'll have that mailing list, and we will, as the results for these pilot trials start to emerge, which they are now. We just heard from Scotland, very amazing data that they are now analyzing. The Stanford trial has wrapped up. That will be presented in June at the International Society for Bipolar Disorder meeting in Chicago. So it's starting to happen. So I would say if Matt were still ill and I was new to this, I would go to the site and start to educate myself and it's kind of a portal for other resources. And then we have this Metabolic Mind Award Programme. 6 clinicians received $100,000. No, 7 received $100,000 this past year for their pioneering work in this area. And so those are the people really, all of their websites have incredible information as well. And I would encourage families to try to get their clinicians on board. I don't think you necessarily want to do it yourself if it's a very serious mental illness, because you want your clinician to be part of the team. You want a psychiatrist, dietitian, at least a therapist on board. One of the things that kept upsetting me along the way was if my husband and I, in our position with lots of resources at our disposal, direct access to Stanford professors and researchers, we could not get our son well until we found the ketogenic diet. How is anybody supposed to be able to find credible information? And so that's one of the things we hope to do, is to answer the question, how can we make this doable and affordable and scalable so that anybody who wants to try it can try it? It's hard, as you were up late on Google, you were calling families. It was hard. Mm-hmm. You had the resources to do it, I had the resources to do it, but most people don't. And so we have to make it easier for people to do this. We need frozen food delivery. We need insurance to be paying for food. We need to make it so that any family can find this intervention and be able to stick with it.
Absolutely. It's not just a privilege or for the few tenacious ones that are able to put the time and energy.
That's right.
We don't always all have that luxury, and that spurs me on because it makes me angry that this isn't available. Another something that you said in one of your talks caught my attention, and it was about casseroles. That you were the family that at that point, and you were unexpectedly the family. And it seems to me like an American tradition. When somebody's poorly, somebody's had bad news, a tragedy, something's happened, then the neighbourhood kind of turns out for that family. And it's the casserole tradition where a hot pot's brought to your house. And that metaphor that you used, it doesn't happen so much, does it, for families with mental health?
No.
Is that a perception that you would like to see changed?
I would. And I was lucky because our son, well, I was lucky and unlucky. Our son was very, very open about his condition. And he also had recorded a bunch of videos on YouTube when he was very ill, when he was not living at home, was sort of wandering around on foot, and posted them. So it was kind of like everyone knew anyway. And so we weren't trying to hide it, but we weren't reaching, like I remember the school that all four of my kids went through, if somebody had breast cancer diagnosis, or if a child was sick, they had something called Caring Bridge, and everyone would sign up, and you'd sign up to bring your casseroles, and you'd sign up to drive the kids around. And it wasn't like we were going to sign up for the Caring Bridge, right? We weren't going to say, our son has a very serious case of bipolar disorder with psychotic features. He's been in and out of the psychiatric hospital. Please bring us casseroles. Even though we needed it desperately. We had 3 daughters at home, and I was in the hospital all the time. And when I wasn't in the hospital, I was on Zoom. I was on Google trying to figure out what to do. So, but it just doesn't work that way. As far as we have gotten with stigma, it's still there. People still feel like, must have been the parents' fault. Still feel like it's something that happens to other people. So I think we have a ways to go. But I will say that in all the years that I've been talking about this openly, I have never had somebody say to me, oh, that hasn't happened in our family. I have always heard, we had that too. My cousin, my aunt, my uncle, my nephew, my friend's daughter, my friend's sister. This touches everyone. And the numbers are climbing. So there's no way anybody can escape mental illness. Whether it's anxiety or depression or eating disorder, or it's touching us all. So let's just talk about it. Let's all just start talking about it.
And anxiety levels and all of the other ones you mentioned, even eating disorders come under the umbrella depression. And my brother, he was diagnosed with a mental illness. We've had lots of discussions throughout his journey. And one of the things he said to me that really stood out was, because it affected his relationships and his friendships so much, that if he'd have had a car crash or broken his leg, and they'd have visited and come to see him and support it. And it was very much when I heard you mention the casseroles in the community, it was that type of comment, where at times you are alone, but we are getting better, talking more openly, and with your work and the others that I think joining forces is going to be so powerful, that you're creating this umbrella. I think the future is going to be a lot brighter. So thank you so much for talking to me and sharing what's going on.
Thank you for your work in helping other families with children who are having seizures. It is the angry families that are going to make a difference, and the hopeful families. I have hope now, and I hope to share that.
Yeah, that's it. It is about sharing hope as well, channeling that trauma and energy. But thank you. We really appreciate you, Jan. Thank you.
Lovely to talk with you, Claire. Take care.
Thank you for watching. If you like this video, please make sure to subscribe. This really helps us to be able to create more content.